Welcome to this important discussion on male reproductive health. Today, we're going to explore a significant yet often misunderstood aspect of male infertility: sperm blockage, a condition that plays a crucial role in many couples' journeys toward conception. Understanding sperm blockage is vital for anyone interested in reproductive health, as it sheds light on why some men, despite producing healthy sperm, face challenges in fathering a child. Our goal is to provide clear, empathetic, and educational insights into this complex topic. Basic biology of sperm. To truly grasp sperm blockage, let's first understand the incredible journey of sperm. Sperm production begins in the testicles, which we can think of as highly efficient factories where millions of tiny, specialized cells are continuously created. These newly formed sperm then undergo a remarkable process of development and maturation, acquiring the ability to swim and fertilize an egg, becoming fully functional. The primary role of each sperm is to carry the father's unique genetic material, his DNA, to the egg for fertilization. Once mature, sperm embark on a precise journey through a complex network of ducts. Their first stop is the epididymis, a coiled tube located at the back of each testicle, where sperm continue to mature and are stored until ejaculation. From the epididymis, sperm travel through the vas deferens, a muscular tube that propels them forward. This pathway is essential for sperm to exit the body. Along this route, sperm mix with fluids from the seminal vesicles and the prostate gland, which provide nourishment and protection, forming the semen that is ejaculated. The entire journey from production to ejaculation is vital for sperm to successfully reach and fertilize an egg, and any disruption along this path can have significant consequences for fertility. Understanding sperm blockage. Now, let's define sperm blockage. It refers to an obstruction or interruption along the intricate pathway that sperm travel, preventing sperm from being properly transported out of the body during ejaculation. Essentially, even if the testicles are producing healthy, viable sperm, they cannot exit, leading to a situation where a man may have normal sperm production but still experience infertility. The blockage acts like a dam, preventing the flow of essential reproductive cells. It's important to recognize that sperm blockage is a distinct cause of male infertility and differs from issues related to sperm production itself, such as low sperm count or poor sperm quality. Understanding this distinction is key to accurate diagnosis and effective treatment. Causes of sperm blockage. Sperm blockage can arise from various factors, some of which are preventable or treatable. One common cause is infection, particularly in areas like the epididymis or prostate gland, which can lead to inflammation and subsequent scarring. This scarring can narrow or completely block the delicate ducts, impeding sperm passage. Prompt treatment of reproductive tract infections is crucial to prevent such long-term complications because ignoring these infections can have lasting effects on fertility. Previous surgeries are another significant cause of sperm blockage. A common example is a vasectomy, which is a surgical procedure specifically designed to block the vas deferens for permanent contraception. While effective for its intended purpose, it intentionally creates a blockage. Other abdominal or pelvic surgeries can also inadvertently cause scarring or damage to the sperm ducts, so it's important for patients to discuss their surgical history with their healthcare providers, as this information can be vital for diagnosis. Developmental defects present from birth can also lead to sperm blockage. Some men are born with missing or underdeveloped sections of the reproductive tract, and these congenital anomalies prevent the normal formation of the sperm transport system. These conditions might not be apparent until a couple tries to conceive. Genetic factors can sometimes play a role in these developmental issues, and early identification can help in exploring appropriate management strategies. Environmental factors can also contribute to sperm blockage. Prolonged exposure to high scrotal temperatures, for instance, can negatively impact sperm health and the integrity of the ducts. This might occur due to certain occupations or habits. While not a direct cause of blockage, it can exacerbate existing issues or contribute to overall reproductive stress. Maintaining a healthy scrotal temperature is generally beneficial for sperm production and transport. Finally, lifestyle choices can influence reproductive health. and potentially contribute to blockages. Smoking, for example, is known to have detrimental effects on overall health, including the reproductive system, and it can contribute to inflammation and oxidative stress. While not a direct cause of physical obstruction, unhealthy lifestyle habits can compromise the delicate balance required for optimal sperm transport. Adopting a healthy lifestyle supports overall reproductive well-being. Symptoms of sperm blockage. Recognizing the symptoms of sperm blockage can be challenging, as many men may not experience any obvious signs other than infertility itself. However, some indicators might suggest an underlying obstruction. One potential symptom is a consistently low ejaculate volume. If the amount of semen produced during ejaculation is noticeably less than usual, it could indicate that fluids are not mixing properly, or that sperm are not contributing to the volume. This is a subtle but important sign to observe. The most definitive symptom, often discovered during fertility testing, is the absence of sperm in semen, a condition known as azoospermia. Despite healthy sperm production in the testicles, no sperm are found in the ejaculated fluid, which is a strong indicator of a complete blockage. Pain during or after intercourse can also be a symptom for some men. This discomfort might be related to inflammation or pressure buildup behind the blockage, and while less common, it warrants medical attention. Discomfort in the prostate area is another possible sign. The prostate gland contributes fluids to semen, and issues with the ejaculatory ducts, which pass through the prostate, can cause localized pain or pressure ranging from mild to significant. Lastly, the presence of blood in semen or urine, though rare, can indicate an underlying issue. This could be a sign of inflammation, infection, or other problems within the reproductive or urinary tract that might be contributing to or caused by a blockage, so any such observation should prompt immediate medical consultation. If you suspect sperm blockage or are experiencing fertility challenges, the importance of consulting a healthcare professional cannot be overstated. A urologist specializing in male infertility is the best resource, providing accurate diagnosis and guidance. The primary diagnostic test for sperm blockage is a semen analysis, a simple, non-invasive test that examines a semen sample under a microscope, assessing sperm count, motility, and morphology. The absence of sperm, or a very low count despite normal testicular size and hormone levels, strongly suggests a blockage. Further diagnostic steps might include blood tests to check hormone levels, genetic testing, or imaging studies like ultrasound or MRI to visualize the reproductive ducts. These tests help pinpoint the exact location and nature of the obstruction. Treatment options. The good news is that various treatment options are available for sperm blockage, offering hope to many couples. Assisted reproductive technologies, or ART, are often a primary approach that can bypass the blockage entirely. One common ART method is in vitro fertilization, or IVF, combined with sperm retrieval. Sperm can be directly extracted from the epididymis or testicles through minor surgical procedures even if they cannot exit naturally, and these retrieved sperm can then be used for fertilization in the lab. Beyond ART, specific surgical procedures can directly address the blockage. Seminal vesiculoscopy is a minimally invasive procedure that uses an endoscope to visualize and treat blockages within the seminal vesicles or ejaculatory ducts, helping restore the natural flow of semen. Another specialized procedure is transurethral resection of the ejaculatory ducts, or TURD, which involves using a resectoscope inserted through the urethra to remove obstructions in the ejaculatory ducts. Both seminal vesiculoscopy and TURD aim to restore the natural pathway for sperm. These surgical interventions offer the potential for natural conception by clearing the obstruction, and the choice of treatment depends on the specific cause, location, and nature of the blockage, as well as individual patient circumstances and preferences. Remember, a diagnosis of sperm blockage is not the end of the road. With advancements in medical science and dedicated healthcare professionals, many effective solutions exist to help individuals and couples achieve their dream of parenthood. We hope this overview has been informative and reassuring. If you found this video helpful, please give it a thumbs up, share it with anyone who might benefit, and don't forget to subscribe to our channel for more health-related content. See you next time.